Hi there, I'm Dr. Francis Shih. I am a child and adolescent psychiatrist with Kaiser Permanente here in Orange County. And one of your classmates, Catherine Wong, has asked me to answer some questions about the COVID-19 pandemic and its effect on mental health. I hope you find this information helpful. First of all, COVID-19 and its subsequent pandemic has affected all of us. And the question is, how has it affected teenagers, especially you? Well, we know for a fact that everyone, especially teens, have struggled with a significant increase in social isolation and loneliness. And what is the impact of social isolation and loneliness? We are humans and we are by nature social creatures. So when we experience prolonged social isolation, loneliness often sets in, as well as mild depressive symptoms. Many of you may have noticed things like low mood, difficulty concentrating, decreased energy, low motivation, difficulty enjoying things that you normally enjoy, a change in appetite, weight, things like that. These are all very common reactions to stressful events like the COVID-19 pandemic, and many of you may have been experiencing this. People also experience often anxiety that comes with a crisis like the COVID-19 pandemic. And how does anxiety manifest? Anxiety manifests as excessive worrying, obsessing over things, and having difficulty getting your mind off of negative things. Disruptions in sleep like insomnia, again, changes in your appetite, feeling tense, and getting preoccupied again by many negative thoughts. How else has the COVID-19 pandemic affected teens? Another thing that has definitely affected not only teens but families as well is if you know a family member or an acquaintance that has actually caught COVID, tested COVID positive, or worse yet, has needed treatment such as a hospitalization for COVID-19. This can be very traumatic for anyone involved, especially if it's somebody you care about, like a family member. And so it's important to remember that everyone has different experiences with COVID-19 in terms of their exposure to it. There will be many of you who have never experienced anything close to this in terms of a family member or someone you care about needing medical care or a hospitalization. And then there are probably a number of you who don't know anybody who's possibly tested positive for COVID or needed treatment. But it is important to be sensitive and to be aware that everybody's experiences with the trauma of COVID is different in terms of its threat to our safety and health. Lastly, for those of you who don't know, 1 in 5 teenagers actually suffers from a diagnosable mental health condition, which is a pretty high number if you think about that 20% of the teens out there. And these teenagers in particular are a much higher risk of worsening their conditions, particularly of depression, anxiety, perhaps past trauma like abuse, bullying, and so on. So these teenagers especially are at higher risk of worsening their symptoms, particularly of depression and anxiety, with the social isolation, with the loneliness, and with the possible exposure to additional trauma related to COVID. And so it's really important to be aware of this, to seek help, to ask for help, including professional help if that is what is needed. Okay, what are some resources or actions that teens can engage in to enhance your mental health? Well, one of the first things that I think is really important is to remain as calm as possible and to be informed. And how do you do that? Most of you are very tech savvy and know how to find reliable information on the internet. And so it is very important, in my opinion, to educate yourself about COVID to a certain basic extent, the fact that it is real, the fact that it's out there, how it's transmitted, and how you can protect yourself by staying 6 feet away from people, masking when you're around people and in public, and taking safety precautions. With information, you can reduce your anxiety and your fears about the COVID pandemic. Luckily, young people have the lowest risk of things like death unless there are high-risk medical conditions that an individual has. So it's important to be sensitive about that in protecting others around you. How else can you stay calm? simple things like exercising. Incorporate that and structure that in your daily activities. Go for a walk outside, take your dog for a walk, go out for a walk with mom and dad. I've seen people take day trips out into nature and get outside as much as you can. Of course, distance safely and wear masks if you're around other people, but certainly incorporating exercise, getting outdoors in an appropriate manner are going to be good for you. What else can you do? Structure your time. It's really important to try to find and establish a regular sleep pattern. Of course, it's normal to be staying up later and sleeping in. My own kids are doing this, but you still want to establish a healthy sleep structure and a healthy pattern in the day with routines like meals, exercise, time to socialize, downtime, and things like that. What else can you do? Well, be flexible and adapt to all this. Look for the silver lining. Obviously, with teens, one of the advantages you have that a lot of older people don't have as much is your ability to virtually socialize through social media, through texting, through video chatting. Your generation is more adept and familiar with this than any other generation. So utilize it to your advantage. It certainly is better than not talking or socializing with other people. So remember the social aspect and the social isolation of COVID and how that can work against you. Well, again, use the tools, the technology you have to socialize with people. As I was saying earlier, also look for the silver lining in things. There's a lot of negative things that you can preoccupy yourself with, but what are some of the positives that are out of this? People are spending more time with their families, are deepening their relationships with their parents, with their siblings, with their pets, and things like that. And so this is an opportunity. Look for the opportunities to enhance things in your life, because the last thing you want to do is get bogged down and preoccupied with all the negatives that are going out there. So we know for a fact, research shows this, when you adapt to a situation, when you look for the positives, you look for the silver lining despite the negatives that are going on, it enhances your resilience, it enhances your mental health. I hope this was helpful for you, and if you have any questions, please let Catherine know, and potentially I can answer them for you more. Take care.